The Eko Health Convention has brought together healthcare professionals, policymakers, industry stakeholders to discuss innovative solutions aimed at improving healthcare delivery in Nigeria. I'm here to bring you the key discussions, measure announcements, and highlights from the event. Let's take a look. The second edition of the Eko Health Convention 2026 brought together government officials, healthcare professionals, development partners, and private sector stakeholders to explore innovative solutions for strengthening healthcare delivery in Lagos State. The convention focused on expanding access to quality healthcare, strengthening partnerships, and leveraging technology to build a more efficient and resilient health system.
Our team is building an healthier Lagos. In December of last year, we launched Latchman Assistance in Distress. It rests on a simple principle that in an emergency, a Lagosian should be stabilized first and ask about payment afterwards. Such is what we plan. Since it became operational in March, in July 2024, I signed the executive order domesticating the National Health Insurance Authority Act, making social health insurance mandatory for every citizen in the state. Some asked why he had to be compulsory. The answer had not changed. Insurance only works when the healthy and the sick, the young and the old, the comfortable and the struggling all sit in the same pool, meaning that we all can help each other, we all can ensure that whatever is not fit here, we can use it from the one that fit here. Voluntary insurance covers the anxious. Mandatory insurance covers the population. Today, more than 1.5 million Lagosians are enrolled under the Ilera Eko.
Governor Babajide Sanwo-Olu reaffirmed his administration's commitment to transforming the health sector through sustained investment, innovation, and digital technology. He highlighted the Smart Health Information Platform, SHIP, as a key initiative designed to digitize healthcare records, improve patient care, strengthen disease surveillance, and support data-driven decision-making across health facilities.
Our function as Ministry of Health is to make sure that that space is regulated, it is operating at international best standards of practice, and that we are able to make sure that Lagosians can access health in their community and one step away from where they live. At the same time, Lagos is also trying to become the center of medical tourism for Africa. We're not far off. We're now somewhere around the position of number 5. We're growing our infrastructure. We're building facilities that can accommodate more and more specialties of medicine and subspecialties of medicine. We are ensuring that even our doctors and nurses that have left Lagos and Nigeria have somewhere to come back to, because one of the biggest reasons that they don't come back is because the disciplines that they've gone to learn and gain expertise in, they can't practice it if they come back. So it's our responsibility to make sure that if you're a brain surgeon, you can come back to Lagos and do brain surgery. You can't do brain surgery in an ordinary hospital. It needs to be a hospital that is specially set up.
The Lagos State Commissioner for Health, Professor Akin Abayomi, said the state is making significant investments in primary health care, workforce development, infrastructure, and strategic partnerships aiming at improving access to quality health care for all residents. Lagos State Commissioner for Health, Professor Akin Abayomi, said the state is making significant investments in primary health care, workforce development, infrastructure, and strategic partnerships aimed at improving access to quality health care for all residents.
What we've done here today at this second Eko Health Convention is actually showcase what's going on within the Ministry of Health. what is going to happen in the near future. And so we're trying to tell people that not only about education, but because people want to know what is in it for me. So because they work in the health sector and we're trying to keep them from jackpying, they need to see that there's actually progress. There was a time, I can tell you, maybe years ago we were at standstill, but ever since this administration started, we've been going forward. We're copying, should I say, we're using evidence-based practice from the top areas where people are going to. We're trying to reverse tourism. And how are we doing that? We're ensuring that, one, we increase capacity. We're actually skilling our healthcare workers. So we want them to stay. We want to encourage nurses and all the other allied professionals that, one, education is very important. Two, experience is very important. If they stick with the Ministry of Health, this is the time to join forces, to collaborate, to speak their minds and say, listen, why don't we do this? Why don't we do that? Other people are doing this. This is what. So come out, showcase. It's an open door policy for Ministry of Health.
Special Advisor to the Governor on Health, Dr. Kemi Oguyemi, described the convention as an important platform for reviving progress made since the inaugural edition, while fostering collaboration and generating practical solutions to emerging healthcare challenges. A documentary showcased the state's progress in healthcare transformation through investment in modern infrastructure, capacity building for all health workers, patient safety initiative, and the implementation of the Smart Health Information Platform, with officials revealing that about 40% of public health facilities have already been digitized. The convention also featured the presentation of awards to outstanding healthcare practitioners in recognition of their exceptional contributions and commitment to advancing healthcare delivery in Lagos State. Stakeholders expressed confidence that resolutions reached during the convention will accelerate healthcare reforms and improve health outcomes for residents. Precious Onu, Alive News Network.
The institutions that matter in the future will not simply distribute content. They will build trust. They will build communities. They will build influence. ANN was created for this moment.